So welcome once again to our family members, friends in the diaspora. Episode 2. So the first episode of the Health Vanguard, the show that we started, with one purpose, being guides to people in the diaspora when it comes to caring for your loved ones. In first episode, we told you why we created the show. One of the things we highlighted were the first principles when it comes to healthcare. I talked about certain things that are undeniable truths when it comes to healthcare. And a lot of times as diasporans or as somebody who used to live in the diaspora, I understand a few things. Human bodies need to be maintained. That's the first concept that we talked about. Concept number 2, being ill or having injury will happen at some point in our lives. The most important aspect, which I think is why Innovarx exists, is once illness or injury happens, we all need care that is continuous. And last but not the least, this is not only for healthcare, any experience has to be dignified and it has to provide people peace of mind. On this episode today, what I wanted to talk about was, how do we start? I always remember living in the diaspora where oftentimes when I call my mom, call my dad, yeah boy, nakayaram. Yeah, baloketa nyari for some people when they speak to their family members. What does that actually mean? Most of us in the diaspora, as much as we love our family members, we have no idea finding out how healthy are they. I talked about illness and injury. Some of the illnesses are just conditions like diabetes and hypertension. And as we tell people all the time, 4 out of 10 adults need continuity of care. So if you're somebody in the diaspora, life is busy, payments are scheduled, you have a lot of responsibilities. Today, what we wanted to talk to you about is, how do you get started? How do we translate mer nakayarambi to actually knowing how healthy my mom or my dad or a family member is? So in Innovarx, I'll show you what that looks like as we come along. This is somebody who has probably talked to a lot of people in the diaspora over the 5 years. I'm going to allow him to introduce himself and what makes you qualified actually to understand what a diaspora goes to.
To be honest, I've been in the UK for over 12 years, so I know the standard that's required when it comes to healthcare services. So in the Gambia, a lot of the people in the diaspora don't actually know how healthy their parents are or their family are. Here at Innovarx, when they come in here, we try to find a healthcare solution that benefits them. We do comprehensive wellness screenings, get them to see a doctor, and then we actually know where they are on their health journey.
A lot of times how we build Innovarx is, yes, he's a healthcare navigator, just not because he has like a British accent, but he understands the psychology of a diaspora. Both myself and Usman used to live in the diaspora. We also know the pains of sometimes family members, what they go through. And what we really try to always do is, before we could help, we need to find out how healthy your family member is. And I'm gonna give you guys an idea of what that looks like, because we have some visuals to show you guys. At Innovarx Global Health, we use this funnel to almost explain everything that we do. Most people in the diaspora, when I talk to them, what I ask them is, when was the last time you knew where they are on their healthcare journey? We use the healthcare map to kind of allow people in the diaspora, because we understand color coding. How early could you find out where your family member is when it comes to their health? For us, green means, hey, they are in a good state. Not that they're the healthiest, because all of us as we age, we have some aches and pains. But green for us means that you don't have a condition that requires continuity of care. Diabetes, hypertension, very common. Yellow zone is when we know we've confirmed that your loved one has a chronic condition like diabetes, hypertension, or any condition that requires at least one medication a day. So much of what we do on day one when we speak to you guys in the diaspora is allowing your family members to know where they are on this healthcare funnel, because oftentimes we know that our health-seeking behavior, most of the times our family members don't seek healthcare unless it's an emergency or it's too late. What that translates to us as a diaspora is something that you could have managed for about $100 to $200 a year could turn into like a $5,000 healthcare expense. And we all know Gambia, the people in the diaspora, they protect people's dignity. You're left with a bill. So Usman, as a healthcare navigator, most of his job is speaking to you, letting you know, we don't know how healthy your family member is, but allow us to start their journey by doing an initial screening, and then we're able to put them in the right category and build a plan for them. We have different ways of saying that. We may tell you they need a treatment plan. We may tell you X, Y, and Z. The most important thing is we cannot help you until we find out where on this funnel does your family member stand. The biggest question we'll ask people in America, in Europe, in Asia, wherever it is, how's mom? How's dad? How's your husband? How's your wife if you are living separately? Do you know how healthy they are? That's the whole point of day one. But also, we know Innovarx is a healthcare company that's US based. So the Gambians in the USA are very familiar with myself, familiar with the Innovarx story. But we also saw Gambians in Europe, in Asia. But oftentimes, tell me a little bit about the first conversation. When somebody calls you, what do they typically tell you about their mom or their dad?
We have like a range of different issues they bring up. My mom's sick. I don't know what's wrong with her. I've been going to different places, still no solution. But once they come here, we do the general check. Most of the time, we do find the actual solution of what's going on with them. And within a month or two, parents are happy, sponsors are happy, and it actually makes me quite happy. So,
what is it about the process? Because oftentimes what he mentioned, I think is important is, munera fa favor, she wasn't sick, you're an alcoholic, I've sent her money, why am I getting it? What does that actually mean? That's like the ecosystem that we live in. Oftentimes diasporans will send money via remittances. Best case scenario, they'll get a piece of paper with medical terminology that they cannot understand. But I want you to touch on the Innovarx transparency because we have Augusta, because we bring that diaspora sponsor along, what does that look like on day one, which typically is a comprehensive wellness screening?
So from day one, I'm actually responsible for registering them. So I register them onto our electronic health record. From there, they come do their full body checkups. Everything is actually tracked on this electronic health record. So sponsors get a live report of what the results are, how the consultations went. And even with our treatment plans, when we go to visit these patients on a month-to-month basis, parents, sponsors, or children would know what their numbers are in lifetime. You'll get it in your email while you're in the office, while you're going to work. You know how your dad's feeling, how your mom's feeling. So it's quite innovative, to be honest.
So what would you recommend? Let's say, take me back to 2011. When I was in the USA, my mom was in Gambia. My mom has been seeking care from Innovarx. Diabetes, hypertension. I call you because in the middle of the night, my mom texts me she's not feeling well. How do you get me started? What's typically the process if somebody reaches out? What are the questions that you typically want to find? Because I know what I ask. Oftentimes I'll ask, where does your mom live? How long has she been ill? Are you aware of any medications that she's taking? But also to get a sense of how well they understand the healthcare condition. But how do you help people? Like if somebody calls you and says, okay, I think my mom is healthy. What does that actually mean? Or I think my mom is ill. What does that actually mean? So how could people get started? Because today's episode is all about how do you get started. Yep. And at Innovarx, we talk about two things, pre-discovery and post-discovery. Nyakaham, aparangaham. Once we know, as people, we hold people in the diaspora with a lot of information to let you know you have to act now because whatever this condition is needs a plan. I think oftentimes I tell people, even if it's not Innovarx providing you with the plan, once we identify that there is a chronic condition that requires continuity of care, we need to equip you with the information to have a plan. So how does somebody get started? What's the easiest way to somebody to get started?
Well, I always recommend, you don't know where your family member is, get a health savings account.
What does that actually mean?
A health savings account is basically a prepaid health token where you pay a certain amount to Innovarx, and now Innovarx will use that account to basically do services for your loved one, whether it be a comprehensive screening, whether it be consultation, medications provision, or even enrollment to a treatment plan. So with this account, you normally get discounts anytime we deduct services, and you also get a balance sheet. So you always know what's in your account, how much you're left with, and what's being used with your healthcare money.
Oftentimes, let's say a Gambian who lives in Seattle, there's a 6-hour difference. Most of the times, healthcare is slow because us in the diaspora have to wait for things to be open, time difference, for you to be able to send money before the care begins. Because unfortunately, we don't live in an ecosystem where people could receive care without payment. The health savings account for me is one of the most revolutionary products on the market, because it's healthcare money that you as a diaspora know is gonna go towards healthcare. And the best way I describe it is, because I used to get paid twice a month when I was in the diaspora, every 2 weeks. Most of the times I used to live paycheck to paycheck. I know a lot of people in the Gambia think us diasporans always have money. So planning is important. So the same way I used to deduct money that goes to my employer for health insurance is the same way most people in the diaspora could dedicate, let's say, $100 or $200 towards healthcare for their family members in Gambia, knowing that now whenever they need care, money is available. And unlike insurance, you don't lose it at the end of the year. So that's the easiest way. I'm gonna wrap up just to kind of remind people. Last episode, we talked about things that are undeniable. And for somebody who's been in the Gambia, who's built Innovarx together with the team for the past 6 years, most of us in the diaspora wait until it's too late before we become proactive with people's care. We're trying to change that. Find out early where your loved one is in terms of getting them screened. If they live in Basse, Bara, Birkama, Soma, we are in the position now to serve the entire Gambia. And that's also something that has tremendous value because a lot of people see us as a Kombo or Banjul area facility. But the same way we could screen your individuals on day one and let you know what is going on, we could put them on a continuity plan that increases visibility. And hopefully the end result, if you ask me, it's good health, yes. But what it means is when you get an opportunity to visit Gambia with your children, maybe you get to find the people that you love in a healthy state. But also I think there's a sense of pride that we notice when their family members are receiving care. Even just Innovarx going to your parents' homes or them coming here, they may not be able to fly over to the USA or Europe, but you are bringing them the best healthcare services they could afford. So any parting words? How do they contact you? Because oftentimes they'll talk to Usman and not myself. How do they find you? What's the best way to get started?
My number is on WhatsApp, and I got a direct number too. You can always reach me on +220-287-4991. I'm very easy to get.
And your email?
My email is usman@innovarxglobal.com.
The Health Vanguard is going to be a series that will continue just to take you along, people in the diaspora, to guide you on how to take care of your loved one. So on the next episode, when you see you again, we'll bring another aspect of how we provide care. But always we say thank you to the diaspora. Innovarx is a diaspora company. We are diasporans that came back home. And without the diaspora, Innovarx will not be around. So whatever we do in terms of information, providing solutions, is also saying thank you to our biggest customers as well too. So Usman, anything else you want to say?
Yes, I did also want to add the health savings account. One of the benefits I didn't tell you, you do get a 10% bonus anytime you pass a certain threshold. So anytime you pay, say for example, $21,000 or above, or $300 and above, you do get a 10% bonus. So always do keep that in mind. I am looking forward to hearing from each and every diasporan or Gambian out there.
Awesome. Thank you, Usman. I took some time.
Oh, thank you, sir.
Until we see you guys again on the Health Vanguard, the Diaspora Guide to Caring for Your Loved One. Deuces.